Right. Hello, everyone. Uh, People are trickling in, so we'll hang on for another minute while some other people arrive. Uh, Everyone's hopefully able to see some slides, hopefully able to see and hear me. Uh, if not, please reach out in chat and we'll do our best to help. So we'll get going. Welcome, everyone. Thank you for coming to the final in this series of webinars that we've been hosting over the last few months. In this one, we're going to be talking about some data that we've been collecting in collaboration with the local authorities we work with. Speaking to why we work with adults around children. So really looking at the effect that changes in adults and improvements in adult skills have on the children around them. We will have a quick look at what we're going to go through. So we'll give a brief introduction to emotional health and talk about the adult role in the development of children's socio-emotional skills. We'll have a brief optional interaction session, so consider this your fair warning. And then we'll show the majority of today's webinar will be showing some data around what changes we see in adults and how those relate to changes in child difficulties. And I'll do my best to walk everyone through that. But please, if you have any questions as we go along, do ask them. And then we'll sum up if it hasn't become obvious already, we'll answer the question of the webinar. Why do we work with adults around children at the end? And then we'll have a few minutes where we can have any discussion or questions. So firstly, who we are. We're the Centre for Emotional Health. We're a charity based in the UK. Our head office is in Oxford, but we work nationally across the UK. We have a vision for everybody to live an emotionally healthy life. And to us, emotional health means a set of skills and beliefs that shape thoughts, feeling, and behavior. It's really the idea that your behavior comes from your feelings, and that if you have the skills to be able to feel and understand and manage those feelings, you'll be able to exercise more control over how you experience the world and how you act. An important part of that emotional health skill set is the ability to create and maintain positive and supportive and responsive relationships with others. And that's the case for adults and children, but it's also the case for adults interacting with other adults. So we think not just about parents and children, but also about parents in the workplace, adults in the workplace, and people in their relationships with everyone around them. We kind of think of this concept of emotional health in terms of a series of assets. So it's being aware of your emotions and what they are, being aware of the context in which you experience your social context in which you're existing, so social awareness. It's beliefs about yourself and who you are and what your strengths are and what you're able to do. Beliefs about other people, whether the world is a good place. Having the agency to be able to make decisions and make changes. And then to put that together and to be able to regulate your own feelings and your behavior in response to your feelings, and to be able to form those important relationships. And all these assets are important and distinct in their set of skills that underpins them, but they work together to form this concept of emotional health. Just gonna adjust my laptop. And we recognise that these supportive relationships are really crucial. and that good emotional health and the supportive relationships that come with it can be protective against uh, against mental ill health. And we'll talk a bit about adults' mental well-being in a few minutes. And where all this connects to child development is through this idea that parents are one of, if not the most important people around children. So there's the excellent Shaping Us framework that was written and published by the Centre for Early Childhood, part of the Royal Foundation, with some input from us. Talks, I think, really eloquently and in really great detail about how parents and adults around children are able to influence children, and it really helps to flesh out what and why those skills that children develop during early childhood translate into good life outcomes. It talks about things like the role of parents and adults in co-regulation, building communication skills, playing and encouraging play in a way that's appropriately challenging to provide that support and social scaffolding for children to learn those really important socio-emotional skills. And I think it's helpful to point out sometimes that adults are not born with the skills to do this, that some of us will have had it modeled to us by our parents. Many people will not have had these kind of skills modeled to their parents, by their parents. And so I think it's worth thinking about, the work that we do as a way to build these important skills for adults so that they can pass them on to their children. And that's really a bit of background into, you know, some of the kind of principles underpinning the emotional health work we do with adults, and why we think it helps with children. And we'll just take a brief interactive break, which can be as interactive or as non-interactive as you like. I think we'll just take a second. I'd encourage you, as we're talking about how adults influence children, to think back to when you were a child. Take a minute to think about somebody. It might have been maybe a parent, somebody in your family, or somebody at school, friend or a neighbor, some kind of professional, some adult whose influence on you still remember. And I wonder if anybody's willing to, in chat, share, a first name or a last name. We don't need to identify anybody. Of an adult that influenced you, their role or relationship to you. If you want to share any details, great. We're not going to read anything out. I just thought we'd take a minute to think about those adults around us that were influential when we were children. And I'm going to do it myself. So I'm going to think in chat. Lovely. Uh, Lovely. Thank you to those who shared. Like I say, I won't read any out, but there's some there in chat if you feel like you would like to share some now or later on, please do so. I think that's a really nice reminder of how important like a really diverse range of adults can be to us as children. That it's parents, yes, but it's all the adults around children who can have this huge impact on children that without wanting to guess anybody's name. We can remember anybody's ages. We can still remember decades later. So we have a kind of idea of emotional health and why it's important for the adults around us, and we have a way that we put this into practice in helping the adults that work around children to model good behaviour and good skills for children. So many of you will know that we offer practitioner training for mostly local authorities, but as well as schools, businesses, and other charities. These are practitioner trainings in a range of programs. Our flagship of which is the nurturing program. So a 10-week program for parents of children ages 3 to 12, as well as a whole range of other programs. We train a few thousand practitioners every year or so, and all those practitioners go on to reach dozens and dozens of parents through the programs they deliver. In schools, we train staff in emotionally healthy cultures, as well as to deliver the range of programs for parents. And in workplaces, we also offer direct delivery of emotional health in the workplace trainings to build those kind of core emotional health skills into the workplace. And this is the one slide that I'll show with some kind of qualitative experiential evidence for how people experience the nurturing program. Parents talk about the confidence it gives them, the skills, the tools they have for their toolbox to be able to manage their feelings, to improve their relationships with their partners, and to be able to understand and support their children better through the development of the children's social skills. And we hear over and over again this idea that parents talk about their improving confidence, feeling empowered, and that's really something that comes up very strongly. And this is a really brief idea of how we think about the work that we do. So we have the nurturing program, which is this evidence-based program for parents that teaches knowledge and skills around emotional health, and some information around parenting and how children's brains develop, so that parents can be empowered to know what to be more confident in their parenting style and skills. And what we hear from parents is over and over again is about how they're more confident. And there's this term called self-efficacy, which is very similar to empowerment, that really speaks to people's self-agency to be able to make the changes that they want to. And I think this idea that we improve confidence is great, and I think to me it's always felt a bit like the step before, that being more confident allows you to then do something that becomes the outcome. And I think that's what we'll talk about for most of today, is like how that change in confidence and self-efficacy goes on to improve adult outcomes in terms of mental health and mental well-being, and also goes on to improve children's outcomes when parents feel more confident. And the data that I'm going to show today is collected by local authorities who are running our programs, who are part of what we call our learning partnership, where we work closely with a dozen of the local authorities who run our programs to collect outcome data directly from the parents who are taking part in programs. So before and after taking part in a 10-week nurturing program, parents tell us about things like their mental well-being using a questionnaire called the WEM-WEBs. Parents tell us about their children's strengths and difficulties using a scale called the Strengths and Difficulties Questionnaire, and about their knowledge of parenting and their confidence and self-efficacy using a tool called the TOPSY. And we'll speak about all these in more detail, but in particular about the TOPSY. And so when we look at parents' confidence using this tool to measure parenting self-efficacy, the TOPSY questionnaire, which is asked before and after taking part in a program, What we see is that at week 1, scores are kind of 320 or 30, and that over the 10 weeks of the program, parents report an improvement in their confidence and self-efficacy of around 50 points. And that's interesting, but I think I've always struggled to really understand what that increase in self-efficacy means. And I think it's really difficult to answer that when you're talking about this really broad topic of self-efficacy. But fortunately, TOPSI is a monster of a questionnaire. It is nearly 50 questions long, takes a good 15 minutes to complete. But that means that it measures confidence and self-efficacy across a range of discrete domains. And this is what we mean by domains. So that in the TOPSI, there are 8 different domains. There are a set of questions about, for example, control. And this is about asking parents how confident they feel that they can stay calm, feel in control, and be able to get the behavior that they want to see in their children without having battles and tantrums. Similarly, you get discipline and boundaries. So parents' confidence in setting and sticking to boundaries and rules, and doing so without feeling guilty. You have a domain of emotion and affection, so confidence, the confidence parents have expressing warmth towards their child and be able to recognize the emotions that their children are displaying. Parents' ability to recognize and empathize with children's emotional needs. To be able to have the knowledge to recognize the developmental changes that their children go through and to be able to respond appropriately, both in their parenting style and the way that they play. And then to be confident playing with and having fun with your children. To be able to cope with external pressures, saying no without feeling guilty or having low self-esteem. Avoiding direct comparisons to other parents and all the kind of difficult feelings that can bring up. And similarly, to be able to accept that you're good enough as a parent, that you have the confidence and the skills to be able to deliver the best for your child. And that's through, be able to manage the ups and downs of parenting that are very normal. And for me, this kind of helps to round out what this idea of improving confidence means. It's that parents are able to feel comfortable that they have the skills in each of or some of these domains of parenting, aka, and which kind of overlaps with emotional health, and then be able to put them into practice. And so this idea that there are domains to parents' confidence and self-efficacy overlaps with our idea of emotional health. The TOPSI is a questionnaire developed by somebody else and it's been in use for years, and it is that many of the parts of it feel familiar when you recognise this confidence of this concept of emotional health. So, for example, to feel in control, you need to be aware of your own feelings. You need to have some self-agency, and you need to be able to self-regulate. So to be confident that you can feel in control, you need to have these emotional health skills. And similarly, if you have self-agency and you're aware of, you have, good beliefs about others, and you're able to self-regulate and you have relationship skills, you can understand the importance of positive discipline and setting boundaries. Your beliefs about others inform the fact that you know that boundaries are not just good for you, but they're good for other people. And so these concepts of these domains of parents' confidence have a lot of overlap with these skills that people need to be able to be emotionally healthy. And we're not going to worry too much about the exact overlap between your emotional health assets and the domains of TOPSI. We're going to think mostly for the rest of for the next half hour or so about just the domains of TOPSI, but just kind of being aware in the background that these mean something in relation to emotional health as well. And when we look at the changes that parents report over the course of the nurturing program in each of these 8 domains, we see that across the board there's kind of generally an increase that their parents express that they're more confident with feeling in control, and that's one of the things that changes the most over the course of the nurturing program. Some things that change a lot less. So parents' confidence in understanding their children's emotion and showing warmth is one of the things that does improve, but it improves by a lot less than some of the other domains. And similarly, pressures. I think this is responding to external pressures, avoiding comparisons to other people, is something that's very hard to change. I'm sure many people can recognize it in themselves that that's a really difficult barrier to overcome. But alongside all these improvements in parents' confidence, we also see that parents report, using the Web scale, an improvement in their mental well-being. So parents that start with, in the blue, with low mental well-being, on average, improve to become in the average range over the 10 weeks of the program. And in fact, 70% of the parents that start with low mental well-being finish with mental well-being that's average or high. And from the local authority that measures outcomes around 3 months later, we know that this improvement in parents' mental well-being is sustained. But how do those two things relate to each other? How do parents' kind of confidence using those skills and emotional health, how does that correlate with changes in mental well-being? And I appreciate this is a complex set of graphs, but I'll walk everyone through it. So essentially what this graph shows is along the horizontal axis is a change in mental well-being. So everything to the right of the vertical line is a parent, each dot is a parent, each dot to the right of the vertical lines is a parent whose mental well-being improved. Along the vertical axis is the change in confidence in each of the TOPSI domains, where a dot above the line means that parent improved in their confidence in that domain. So parents who are in the top right corner improved in both mental well-being and that domain, whereas parents in the bottom left saw a reduction in mental well-being and a reduction in their confidence in that TOPSI domain. And across all of the 8 domains, we see that there is a correlation, that when parents' skills in all these 8 domains go up, their mental well-being goes up as well. But what we find interesting when we look at the individual domains is that some are correlated more than others. So when parents' skills and confidence in managing external pressures go up, there isn't a big difference in their mental well-being. But when parents' skills and confidence in being able to empathize with their children goes up, you see a really strong correlation with an improvement in that parent's mental well-being. And the same thing happens for play and enjoyment. That when parents are confident being able to play with their children, their mental well-being goes up significantly. And this number down here, the R squared, is just a measure of how correlated, how related those two things are. And so empathy and understanding and play and enjoyment are the two things that are most important for improving parents' mental well-being. And we can also, as well as parents' mental well-being, we can also think about children's outcomes. So many of the parents who take part have also filled in a strengths and difficulty questionnaire that tells us about the changing skills of the child that they're in the program for. And so looking first at the pro-social scale of the strengths and difficulties questionnaire, which measures children's social and emotional skills, we see that the children who start very low in black, so with very low parent-reported pro-social skills, after 10 weeks on average, they move from very low to low. And that improvement is maintained 3 months when you ask parents 3 months later. Something similar happens for children who start with low pro-social skills, that they improve over the course of the 10 weeks and they stay roughly as high. And when we look across these, look at the children that are going through these transitions, we see that 40% of children, 40% of the children of parents who start a program have very low levels of pro-social skills. But what's more positive is that over half of children who start with low or very low skills move up a whole category from very low to low, or from low to slightly low, or even up to slightly lower average. But what's interesting is that when we look at what are the adult skills that are important for those children's development of those children's pro-social skills, we see that it's a different set of skills to the things that are important for parents' confidence, parents' mental well-being. So what we see is, again, that when with child pro-social skills along the horizontal axis, so everything to the right of the line is an improvement, and everything above the horizontal is an improvement in parents' confidence in that domain. We see that some skills like pressures, being able to respond to external pressures, are not important for children's pro-social skills. But the ones that are emotion and affection. So when parents are able to express warmth, recognize the emotions that their children are feeling, that's when children's pro-social skills also improve. Similarly for play and enjoyment, when parents are better able to play with their child and have fun with their child, that's when children's pro-social skills develop. And the third most important for children's pro-social skills is learning and knowledge. That when parents know about the developmental changes that their child is going to go through, and when they're confident to be able to make changes to how they interact with their child in response to those developmental changes, children's pro-social skills develop more. So parents being informed and having confidence in recognizing emotions and being able to play in an appropriate way with children are all really important for children's pro-social skills. But the other skills, like feeling in control and being able to use positive discipline, are less important for children's pro-social skills. And when we turn that around and we look at, instead of child skills, we look at parent-reported child difficulties, we see something interesting as well. So the difficulties part of the strengths and difficulties questionnaire makes up about 80% of the questionnaire, and that's really one of the reasons that we don't love the strengths and difficulties questionnaire. Is it is quite negative. I think it makes parents feel quite judged about spending so many questions reporting on what's wrong with their child's behaviour. But it is what we have data on, and as far as we're aware, there isn't a good alternative at the moment. So what we find is that similar to the pro-social skills, a majority of children start our programs with high or very high levels of behavioural difficulties. We know that for the children who start very high, over the course of the 10 weeks, they move down to just be high. The children who start high move down to be slightly raised. And those who start slightly raised improve to be just on the cusp of average. And we look at the numbers of children in all these categories, we see that almost a third of the children who start with very high difficulties improve not just one, but two categories at least. So from very high to slightly raised. And that's just over the course of 10 weeks. And when we look at again at 3 months, we see that the improvements in children's difficult behaviours are sustained. And this is the last one of these that I'll show. But this is looking at how parents' skills and confidence in different domains correlates with changing child difficulties. And because we want children's difficulties to go down, the direction of the lines is reversed on this one. So to the left of the vertical line are dots where parents reported a reduction in difficulties. Whereas above the horizontal line is a parent who's reported an improvement in their confidence in that domain. So the top left corner of each graph shows parents who have improved their confidence in that domain and their child has reduced difficulties. And what we find, I think, to me, this is the most interesting set of all of them because the lines don't all go in the same way. That we see that emotion and affection, which remember was really important for children's post-social skills, doesn't have any correlation in these data with children's difficult behaviours. Similarly, learning and knowledge, which was so important for children's pro-social skills, isn't correlated with children's improving difficult behaviours. But what is correlated is these domains of control and discipline and boundaries. And remember that this is not being in control of a child, this is feeling in control. It's staying calm and having confidence in setting boundaries and asking for and enforcing those boundaries without feeling guilty. So it's not a case of these two things being equivalent to being more strict. It's parents' confidence in positive discipline and that idea of self-agency, of feeling like you're in control. And when parents feel like that, they're able to help children to know what's appropriate and to behave differently. And if you had to pick a third that was the next most correlated for child difficulties improving, it's empathy and understanding. So as well as feeling in control of yourself, being able to understand what feeling your child is going through and what they're trying to express when there's difficult behaviours is the next most important thing to be able to support them. So this is just a visual summary of how of those all those complicated graphs with all the dots. So when you think about in the first column, parents' mental well-being, the things that are important to help parents' mental well-being are empathy and understanding, being able to recognize the emotions in your child, and to be able to have confidence playing with your child. The most important for improving children's pro-social skills is to be able to recognize the emotions your children are trying to express and to know that they will go through different developmental stages and to be confident being able to respond appropriately. The things that are most important for improving children's difficult behaviours is parents feeling in control and being confident, setting appropriate boundaries and enforcing them without feeling guilty. And like we said, next on the list is empathy and understanding for the feelings that your child's trying to express. So I won't ask you to put anything in chat unless you want to. But I guess just the idea was to think back to the adult that you nominated earlier on. And thinking about it, that what was a presumably very personal relationship, whether and how that lines up with these skills, that adult's mental well-being, your skills and difficult behaviors as a child, and to see whether you kind of recognize anything that comes from this very data-heavy set of slides that means something maybe a bit more relational to you. So we'll just have a think about that for a few seconds. And the other thing that I wanted to highlight was that if you think back to the very first graph that showed the improvement in each of the domains of parents' confidence, the thing that moved the least in those was parents' confidence in emotion and affection, being able to recognize emotions and express warmth towards their child. That improved the least of all the 8 domains. But what we see here is that when it does improve, it has a huge impact on children's prosocial skills and on parents' mental well-being. So I just wanted to highlight the importance of that, of understanding what it means when any of these domains changes for a parent. It has these real world impacts, not just for them and their mental well-being, but for their children. Just a reminder that if you have a question, please pop it in the Q&A and we'll get to it in a couple of minutes time after I've done the last 2 slides. So I appreciate that's a whole bunch of data, and in a roundabout way, I hope we've answered the question of why we work with the adults around children. You know, we definitely recognise it's not the only thing to do with families who are in need, but we think that the programs that we've developed and that we work with local authorities to roll out across the UK is the best way that we've thought of to be able to translate those principles, that evidence from across the early years field, that emotional health is important, that children's skills in this area are important for their outcomes, and to be able to do it at scale for adults in a really wide range of situations. We think we can show that supporting parents and carers to develop those skills benefits not only the adults and not only the children in their care, but everybody in that child's orbit. And thinking back to the adults that we all recognise having a big impact on us, many of the examples that people put in chat were not of their parents. They were other adults in their orbit whose skills, empathy, had a positive influence on them. So when we're able to upskill those adults, we're making an impact not just for them, not just for their children, but for their whole families and the whole system that they live in. And I guess the other reason is because we know how important these skills are because we use them every day. You know, we probably think more than most people about emotional health on a day-to-day basis, and we try and build it into every aspect of our of our working lives and personal lives. And so we see every day that these kind of skills are really important. I'm going to stop sharing there. I'm going to point you to, we'll share these slides afterwards. We'll point you to a couple of other evaluations that have been published by people independently of us. One of the nurturing program in prisons in Liverpool, done by Liverpool John Moores University, and one that's due to be published, I think, any day now by NPC about our work in schools. So those links will be available to you afterwards if you'd like some further reading. I'll finish on this slide just to say thank you. It's been interesting for me to put all these data together. If you have questions and comments, very happy to answer them. If you'd like to hear more, we have a series of podcasts, which you can find wherever you like. Do follow us on LinkedIn. And if you are interested in data and things, please do reach out. Yes, Lynn, we will share slides afterwards, and so I'll take this down so that we can answer any questions. Magnor, any questions?
Yep, we have some questions in the Q&A. One person has asked, do you have information on disaggregated domains of the SDQ difficulties? Also, how would you explain the decrease in pro-social scores post-treatment among those who had high pro-social scores pre-treatment?
Great questions. Yes, we do have information. We have all the responses to the SDQ, so we can disaggregate those difficulties questionnaires. We haven't done so yet, but it's certainly something we're interested in, and we're hoping to work with academic collaborators to be able to analyze these in more detail. So watch this space. We hope to be able to share something in more detail soon. We have lots of ideas about why some scores decrease over the course of the program. There's, for example, definitely a fraction of adults who report very high mental well-being scores at the beginning who end up going down over the course of the program. Some of that is due to issues in collecting baseline data, with vulnerable families who don't have trust built with the people collecting the questionnaires yet. Others is about this idea of conscious incompetence, that we can be quite happy not knowing what we don't know, but once you have a much clearer understanding of what emotional health is, what your feelings are, and what the feelings of your child are, you may become aware of things or comfortable or confident reporting things that maybe you weren't clear on before, even if they were there. So we think a significant fraction of the people whose scores decrease is because of that, either that idea of it's really hard to collect a baseline when you're in that difficult situation, and because there's the idea of conscious incompetence, that once parents know more about their feelings and their child's feelings, that they're able to identify and report issues much more confidently.
Great. Another question was, please explain a bit more about self-agency.
So we put self-agency at the center of our assets because it's really to me, it's the kind of decision-making center. The idea that your feelings and your behavior are not separate, that one comes from another, that you can be aware of your feelings, but unless you know that how you react to your feelings is within your control, you're not able to self-regulate. So to me, it kind of sits at the middle of being able to actually put what you know, translate what you know into practice. I don't think I have a better explanation that I can give in 2 minutes. I think we can maybe we'll ask Rowan to do a webinar about the assets in detail.
Great answer. Another question in the chat was, what is the age range of the children? Are you able to gather consent to link to school data or test scores, or even the EYFSP?
age range of children varies depending on the program. We don't collect it directly, but we recommend that. So we recommend the nurturing program for parents of children aged 3 to 12. But we know from our data that the parents who come on it have children all the way from 0 to 19, often because they have multiple children. We don't directly collect the age of children that are being reported in the SDQ, but we assume that it falls within that 3 to 12 range. Was that the question?
Yeah. Another question was, for adults around children who may have been mandated to attend a program, how can you encourage them to complete some of these lengthy outcome measures?
Great question. Sorry, I've just remembered the other half of the last question, which was, can we link to other data? We don't collect linked data at the moment, and all the data we do collect from local authorities is de-identified. So it's not personal data. Local authorities do collect consent to be able to link it usually, but many of them don't have the ability to do so, and we haven't been able to tap into that linked data yet, but it's something we'd love to explore. Sorry, back to this one. How can you encourage completion of lengthy outcome measures? Great question. I think we don't know the answer yet. It's something we're working with our learning partners on, being able to collect what best practice is and then be able to share it onwards. I think we'd be guessing if we answered that ourselves.
Another question was, are there any emerging tools or technologies that could maybe revolutionize our ability to support adults and by extension improve child outcomes?
Possibly. I think those of us who go to conferences and things see lots of new flashy interventions and tools and things. Many of them don't end up having a long-term impact. So I think we're cautiously optimistic that things like AI and stuff will be able to help parents to feedback on what's happening for them and what their outcomes are. But I don't think we've seen any good examples of it yet.
Okay, another question was, beyond parents and primary caregivers, what's the impact of involving other adults like teachers, mentors, and extended family in shaping child outcomes?
I think one of the things that we hear from local authorities who are running our programs is that one of the benefits of this kind of multi-agency working, where schools and teachers may have the same training, is that the idea of like a common language around emotional health is quite helpful. That for children to be able to hear the same types of information expressed in a similar way at home and at school can be really helpful. And it's helpful not just for those children, but for for teachers and the parents of the pupils to be able to have a common set of language to be able to talk about emotional health people tell us is really helpful.
Okay, our last question is, how do you design programs so that adults and by extension their children continue to thrive once structured support ends?
Yeah, I think that's a good question as well. We certainly have ideas that, one of the key skills that we hope people get from our programs is the ability to form and maintain positive relationships that will be supportive long into the future. Anything that we can do to support parents who are taking part in programs to kickstart those supportive relationships, I think is really helpful. One thing that some local authorities do is to put parents in touch with each other, encourage them to form a WhatsApp group, or kind of similar to post NCT classes, parents to get together and continue to support each other after the group has finished. I think that's one thing that's been done to good effect. Anything else?
Yep, those were all our questions.
Fab, great. Thank you very much, everyone, for joining. Do get in touch if you have any follow-ups. we'll be sending a questionnaire out in the next day or few, asking what your views are on webinars, what kind of thing you'd like to see if we decide to do a series 2 in the future. But thank you very much, everyone, for your time and attention and discussion, and for sharing in the chat.